whatever's relevant, and as a physician, as a psychiatrist, you're obliged to be up to date with the side effects of drugs. And in the course of psychiatric practice, I think it's essentially drugs that involved informed consent. I think less and less today is ECT being used. But even then, I think the patient has to be advised of the risks and benefit ratios of ECT. And also treatment options, treatment plans. There's so many different possibilities for individuals that have depression, individuals that have anxiety. And it's always advisable as a physician to have a written agreement with your patient. Now, it might be a drag, but it's not that difficult once you have a precedent. And I have one available, which I think Cipla will make available with a pack after the video, etc. has been done. And in that pack, you just spell out, and you just change the blank spaces. You know, I've diagnosed you as having depression. The range of treatments is A, B, C, D, F, G. I've recommended E for the following reasons. And it's done in plain language, because the Consumer Protection Act insists on plain language. It's a problem for us lawyers, because we used to like a lot of Latin. We charge more because the documents were longer. So that's sort of over now. It's got to be in plain, simple language. And very importantly, as I've referred to the National Health Act, if your patient speaks only Zulu and comes from a rural environment, the Queen's English ain't going to do. You're going to want to have an interpreter to translate and have the documents co-signed by the interpreter. It was explained to Mr. X, Ms. X, in Zulu that the contents of this document, and he or she confirmed understanding that document. It may be a drag, but you know what, rather that litigation, because there's so many guys like me out there now suing. And I must tell you, I'm being sued as well. Chinese get sued also, because there's a greater consumer awareness throughout the world. And it's come to South Africa. People are more aware of their rights. And very often, let's face it, we all make mistakes. I've been in practice 40 years. I have made mistakes. Not deliberately, obviously, but you make mistakes. And that's why we have PI insurance. And I think we all need to be honourable enough to say to our clients or patients, look, I think you need to be advised of your rights.